Initially, before we start the medicines, as I told you earlier, lifestyle modification is important. The person has to reduce the weight because obese people have more reflux. So by reducing the weight, reflux will be reduced. And the diet control, the quantum of the food should be reduced. The patients generally tend to have large stomach full quantity of food. This what happens, there's a relaxation of the lower esophageal sphincter and reflux occurs. Naturally, because of this volume, the pressure of the food itself can cause the laxity of the sphincter. So a patient should have small quantity meals and more frequent meals. The stomach should not be put at a tension. By this, most of the symptoms can come down. And then avoiding the precipitating or risk food items. What are these? As I told you, we should avoid especially the fatty diet, the chocolates, alcohol, avoiding tobacco and spicy ingredients like citric acids and then this ginger garlic especially I prefer not to give, and then less of this tomatoes, and other common things, aerated drinks. This is one of the main cause. The aerated drinks are being consumed a lot by the present generation, and it has started more so in the Western countries. This is, they don't drink water, they just drink aerated drink in between their snacks. So this causes more reflux. So this is one of the things which should be avoided. Now, regarding the medicines, what medicines to be taken by the patient? Generally, they keep popping up this antacid pills. But always okay, for a time being, for an emergency, it's okay. But if the patient is recurrently having this problem, he has to consult a doctor, because doctor will decide what type of medicine to be given and what are the other drugs which are causing this and what is his lifestyle. So all this has to be addressed by the doctor. So always better to consult the doctor. We have so many medications which are available in the market for controlling the reflux, the symptoms. Apart from the antacids, we have H2 blockers, we have proton pump inhibitors. There are so many. Each one has their own benefit. And then other aspect is a prokinetics. We have to give a prokinetic generally in this to avoid reflux. Prokinetic is a medicine where it increases the stomach motility. By increasing the stomach motility, the duration of food in the stomach is reduced. So once the duration of the food in the stomach is reduced, there is no pressure on the lower esophageal sphincter. So this adds to the treatment and benefits the patient. So prokinetic is good, and then acid suppressant agents like the H2 blockers and the proton pump inhibitors. So these are the very important armamentarium in this thing we'll have for the treatment of GERD.